Patients should feel very comfortable coming to MRH because they have a top-notch team here. The team is highly trained and they care about each individual patient. We just did a total wrist arthroplasty, which is a total wrist replacement. The total wrist arthroplasty is not a very common procedure, and there's a few reasons why. One is the implants have been in development for several years, but they took a while to get it all the way right. The other issue with why it's rare is because you need the right patient for it. The patient that gets a total wrist replacement has to have arthritis that's just right, the bones have to be just right for the implant, and the patient has to follow the lifting restrictions. Wrist replacements are not like a hip replacement or knee replacement where they're going to hold up to all activities that a patient's doing. You need someone who's going to limit their activity after a wrist replacement. Those patients typically have a lot of pain in their wrist, they've lost some of their motion due to their arthritis, and they're looking for an option that's going to help them preserve motion. For the patient that we just did the wrist replacement on, what I'm hoping to see is that he maintains his wrist flexion extension and maybe even gets a little bit better than what he had prior to surgery. And as he goes through that motion, he doesn't have any pain. He still will have good pronation and supination, which is turning your hand palm up and palm down. That's our most important motion that we do with our wrist and hand. The flexion and extension is less important, but after we put the implant in, we checked his wrist and he's got good flexion and extension. The number one goal is for him to be pain-free and have a functional wrist and hand. MRH is a facility that really focuses on their patients, but they also focus on their surgeons. I don't feel like I walk into a big corporate world when I come here. I come to a small community hospital that has their focus on patient care and helping surgeons and physicians deliver that patient care. I've worked at hospitals around the country through my training, and the care that people get here at MRH is just as good as they would get at a large academic center in a big city. MRH is a small community hospital, and it's a resource for people in this town. When I come here, I know that I'm helping support a hospital that is here for their town and their people.